Good evening, everyone. Welcome to Medical Monday. I'm Carrie Sharp. Glad to be with you tonight. Our topic tonight is a tough one, but one that needs to be talked about. We're talking about Alzheimer's awareness. We're talking about the disease and treatment and prevention. Any questions you might have, go ahead and give us a call. We're going to try and get them answered tonight. As always, we try to take as many calls as we can get in over the next hour. I have a wonderful neurologist joining me tonight, Dr. Lucy Ledbetter. Thank you for being here so very much tonight. We appreciate it.
Thank you for having me, Carrie. It's good to be here.
You've been on Medical Monday before. I'm hoping that we'll get lots of calls tonight, lots of questions that we can answer for folks. You treat all disorders of the brain and all injuries that happen with the brain, but tonight we want to talk about Alzheimer's, and I know this is a big part of your practice there in Columbia.
It is.
More and more people are being diagnosed right now. What are the odds of diagnosis at this point?
Well, for people over 65, somewhere between 6 and 10% have Alzheimer's disease, and when it gets to age 85, it's higher than that. It's more like about between 11 and 14%. So it's very common, and there's a number of risk factors and a number of ways to help lower your risk as well.
And as we see this baby boomer generation age, those numbers are just going to go up. We know that as a fact.
Yes, that's true, and because women live longer, unfortunately, women have a higher risk of having Alzheimer's disease as well.
If you have a question about Alzheimer's disease tonight, whether it's about diagnosis, prevention, treatment, drugs that a loved one may be taking, go ahead and give us a call right now. 615-737-PLUS is the number to call. I'll give it to you again and we'll get it up on the screen. 615-737-PLUS. As soon as we get those lined up, we will take them. But in the meantime, I'll be the one asking the questions until we can get yours tonight. Let's just start with the very basics, Dr. Ledbetter. What is Alzheimer's disease?
Alzheimer's disease is a type of dementia that is progressive and is incurable. Unfortunately, it gradually starts with short-term memory loss, and as the brain deteriorates, it leads to change in behavior, change in abilities to socialize, and lessened ability to perform your daily activities and perform your job, and it eventually, over 3 to 10 years, can lead to death.
So that is the lifespan of once someone is being diagnosed, or really it presents itself in a person, 3 to 10 years.
That's about right, yes.
Now, obviously, we all know when it comes to Alzheimer's, it means forgetfulness, and so when people have this around them, they hear about it, maybe they have someone in the family who's been diagnosed and they're like, I can't remember where I put my keys, where was my cell phone? And you immediately think, do I have it? How do you know when forgetfulness is really a key to Alzheimer's, when you're really moving in that direction?
Well, Carrie, that's a great question. There's a big difference between forgetfulness and dementia, and Alzheimer's disease is one type of dementia. It's the most common type. About 2/3 of the cases of dementia are Alzheimer's disease, but there can be other causes as well. But forgetfulness is normal for everybody. In fact, the most common cause of forgetfulness is you're just doing too much. You've got too many things in the air, but dementia is something very different. Dementia means that you forget on a regular basis. Typically it starts with short-term memory loss, but it involves other things as well. It involves trouble managing your finances. It involves changes in behavior, inability to adapt to new situations. It can involve anxiety and depression, and eventually it prevents you from having normal relationships with your family and friends, and prevents you from performing your job. And typically there's a long prodromal period. In other words, it takes a little while for it to develop, but then when it does, it's fairly unmistakable because people really just cannot manage their lives.
I can speak from my own family's journey with dealing with 2 different people in our family with Alzheimer's, my grandfather and now my stepfather. I've noticed that the people closest often are the last to say there's a problem, and it's the people 2 or 3 times removed from the person in question. They'll say, I think something's going on with granddad, or I think something's going on with stepfather. And with Alzheimer's, I do know it's so early, or it's so important to get diagnosed early, right?
That's right, Carrie. It's important to get diagnosed early because, first of all, you want to rule out other causes that are potentially treatable. There are some causes that you can identify early that are actually reversible and can be treated, and you can prevent further deterioration. But also, there are some medications that will help increase the chemicals in the brain that are responsible for memory and help preserve your memory as long as possible, and keep a patient able to function as long as they possibly can.
So ideally, when people would come to your office, what would be noticed? Why would somebody bring a loved one in, whether it be a father, or bringing a daughter, bringing a father in, or a spouse bringing their husband or wife in? How would you like them to present? At what point?
Well, I would like them to come and see me as soon as they realize that there's a problem. I think in general, families know what's normal and what's not normal. Everybody forgets their keys, everybody forgets details, but when you start forgetting daily or on a regular basis, or when you forget things that you really should know, forgetting names of family, for instance, or things that really don't make sense as far as simple forgetfulness, that's a very important warning sign that something more serious may be going on and that it's time to get help.
So what do you look for medically? Well, how do you diagnose someone?
Well, medically speaking, when I first see a patient, I take a good history because there's a lot of clues in the history that might be important. For instance, ever having a serious head injury can increase risk. Having a history of depression can increase your risk. There's a whole list of things, but apart from that, I'm particularly looking at that first visit for things that might be reversible. For instance, has the patient developed this rather quickly over the last month or so? Have there been falls? Could there be, for instance, hematomas or subdural hematomas in the brain that might actually be masquerading as dementia? Sometimes pure depression mimics dementia, and that's something that is very treatable. So on the first visit, I'm really looking for things that I can reverse, and a typical series of tests that I might do would be a memory test in the office that gives me an idea of what degree of memory problems and what degree of impairment that person has, and then I'll typically do an imaging study like an MRI, and I'll draw some blood looking for metabolic problems like vitamin B12 deficiency or thyroid disease that might also be mimicking Alzheimer's disease.
When you look at the brain of someone with Alzheimer's, what are the key factors?
Well, on an MRI, what I'm looking for specifically with Alzheimer's disease is a shrinkage of the area of the brain known as the hippocampus. There's one on each side, and those are the areas responsible for memory. Now, I may not see that very early, but I will eventually see it on MRI if it's a diagnosis of Alzheimer's disease. But also importantly, I'm looking to rule out other things, such as a condition called normal pressure hydrocephalus, which is a type of dementia that involves a buildup of pressure on the brain. That's something that's potentially reversible, and like I said, also brain bleeds, strokes, things like that I could either reverse or maybe halt in their tracks.
Okay, we're going to take a quick break. I want to remind you our phone lines are open. We do have one caller waiting ever so patiently. We'll get to you right after the break. The number is 615-737+. So go ahead and give us a call during the break if you have a question about Alzheimer's disease, and we'll get it answered after this.